Hello, and welcome to One World, One Health with the latest ideas to improve the health of our planet and its people. I'm Maggie Fox. Planet Earth faces many challenges: pollution, climate change, and new and re-emerging infectious diseases. This podcast is brought to you by the One Health Trust with bite-sized insights into ways to help. In this episode, we're talking to Dr. Bethany Young Holt, founder and executive director of CAMI Health, an organization dedicated to advancing the health of women and girls worldwide. She's also the co-founder and director of the Initiative for MPTs, that's Multipurpose Prevention Technologies, and a principal investigator at the Public Health Institute. She's been working to advance the development and use of multipurpose prevention technologies, products that would provide not just contraception, but protection against HIV and other sexually transmitted infections for people around the world. Bethany, such a pleasure to speak with you.
Yes. Hi, Maggie. It's such a pleasure to be here. Yes, I've worked in different parts of the world. I've been really fortunate to be able to do that. And working in sub-Saharan Africa, I've seen just the devastating effects of HIV in women and girls. And I think what HIV has sort of gotten, and AIDS, it's gotten off the radar of so many people recently, but yet it remains a really devastating disease for young women and girls in sub-Saharan Africa, where in parts of sub-Saharan Africa, they account for 63% of all the new infections for HIV, and it remains the leading cause of death for women of reproductive age.
Well, and what you're working on is combining protection with contraceptives. Contraceptives already exist. Why do you need to combine them with products to protect against HIV and other sexually transmitted infections?
Yeah, if you just think about women and our risk are really interlinked. When HIV, other sexually transmitted infections, the risk of unintended pregnancy, these can all be caused by having unprotected sex or unsafe sex. To have single products that can combine prevention for these different risks could be real game changers for women's health. Because contraceptives are already on the market and people are used to them, there's less of a stigma around contraception as compared to HIV or other STIs. So another advantage of combining prevention from HIV with contraception could be increased uptake of HIV prevention.
And you've actually asked people, and especially women, what they want. What have they told you?
It's really interesting because there's no single answer, except that, what we do here is that women want choice. At different times of their life, depending on their stage of life or where they live, they want different types of products. So, for example, young women who may have just infrequent sex might want one kind of product that they could use on demand, say, something that they might only need to use like a couple times a month. Someone who's married or in a long-term relationship with their partner might want something that's long-acting that gives them pretty much constant protection. We need to have more choice for women's health.
And women need something they can use privately as well, right? There are very complicated issues with a woman's husband or partner knowing that she's using a product at all, right?
Yeah, you have different situations, but that's exactly right. Some women do need to have something that is like a stealth product, something that she can use, if she's in a situation where she needs to have discretion for what she's using. Maybe her husband or partner will feel threatened if she's, using something, for HIV prevention or contraception. And so some women are sort of in controlling environments and relationships. So to have a method that she can use and control herself could be very empowering. Condoms are an example of a method that is out there on the market, male and female condoms that provide protection against HIV, other STIs, and contraception. But even the woman's condom or the female condom, the male partner is aware of it. And so it's not something that is truly in control of the woman or girl. And so there is this growing field now of multipurpose prevention technologies, which researchers are developing these products, say vaginal rings and films, even injections that could be just given to women that would provide women with an array of different types of protection in different dosage forms and durations.
This all seems like a no-brainer. Why is it so difficult to get this field going?
It does seem like such a no-brainer. And people have been working towards this for decades, frankly. It's been the fields of HIV and contraception and other STIs have long been siloed politically and due to funding streams. But about 12 years ago, researchers came together from across these disciplines, family planning, HIV, other areas of sexually transmitted infections, to really come together, bridging these silos to advance this field of multi-purpose prevention technologies. And so there is a growing field. The NIH is funding it, USAID, some other funders are, but the funding, the huge challenges of funding. There's for the most part, no big pharmaceutical companies are involved in this space. So you have small biotechs and academics. And so it just takes a lot of time to raise the funds and then to get even promising products through the development pipeline. There could be very promising products that are, go through early stages of development, but if the funding stops, then that product can't move forward, can't get into the clinical trials, and ultimately can't reach the hands of women and girls.
Can you tell us a little bit about some of the stuff that's in development?
Yeah, it's really exciting. So there are intravaginal rings. There's an array of different types of intravaginal rings so if you imagine like the Nuva ring that's been on the market for a really long time for contraception, but this would be a ring that actually delivers different drugs for, if you will, for different indications. So, a ring could deliver a drug for HIV, for herpes, and for contraception. There are also some vaginal films in development. So if you can imagine sort of the Listerine film that you could put on your tongue. There are researchers that are developing sort of a film that could deliver as a way of delivering drugs for contraception and diseases like HIV. And there are also long-acting injectables. So if a woman comes into a clinic for her contraceptive injection, she could also get either co-administered with a drug for HIV, or maybe it could be even co-formulated in the same application. I would say my organization, CAMI Health, and the Initiative for Multipurpose Prevention Technologies, we actually track the different products that are in development in a database at MPTs101.org. And it's a growing field and it's evolving. Things get funded and then they stop getting funded. So it's
Sounds like it's a bit of a challenge.
It's definitely a challenge.
What's scaring the pharmaceutical companies away from this area?
Prevention doesn't tend to make as much money as treatments. There's few, even in the contraceptive space, there's few big pharma in this space anymore because of perceived lack of return on investment and other risks that they might see when, testing products for prevention. Working on it, the big pharma is in looking at this space. It's just, putting in sort of, I guess, a big toe instead of, the full leg.
And that's where organizations like yours come in. You kind of fill those gaps.
We try, yes. We are really working to try to find other types of investors, get the word out. There's a growing cadre too of impact investors and social impact investors who are willing to invest but take maybe a smaller return on their investment. So we're really working to try to identify these types of new investors that are out there and get them excited about this growing field.
Well, some people might not be excited about this field at all. They might say, look, women just need to be in a marriage if they want to have sex. They need to learn how to say no. Why can't people just control themselves? And then we wouldn't have any of these problems at all.
It's very mind-blowing to think that people really think that, but I know you're right. I'll tell you a story about really what really inspired me. One of the reasons I've dedicated my career to this work. I had the privilege many years ago of working in Mauritania, which is a country in West Africa, and I was a health volunteer. I was working in a rural village. Mauritania is, on the edge of the Sahara Desert, I was working in a village on the edge of the Sahara Desert. Mauritania, a lot of it is the Sahara Desert, but so in this region, women, and girls are often married very young. And have to drop out of school. But I was living with a family which really valued education of their daughters. And two of the young girls that lived with me really excited to go to school, and they went off to a neighboring village, probably a half a day's away by horse cart. And so it was a big adventure for them to go to this village, and they wanted to go to school. They were in school. And I went to visit them a couple months later, and I came to realize that my one little friend, she was 12 or 13, she was so sullen. And it turned out she had lived with her uncle and had been raped by a family member. And all she wanted to do was get an education and do something really exciting with her life. And this was completely out of her control. And, she ended up getting pregnant, and, it's devastating. So I think, those kind of stories, it's not just in, villages in Africa, but you hear about that all over the place in California and Iowa. So it's a very sad reality where girls are not empowered necessarily.
Around the world, even married women don't have any control over what their husbands do. Women in other types of relationships don't have control over what their partners do. And so this would provide them a way to protect themselves.
Absolutely. Yeah. And it's, these multi-purpose prevention technologies, these products that, could provide women, with opportunities to protect themselves in all sorts of situations, even, young women, if they're dating, not always, and married women who are in situations where they just want to protect themselves from unknown risks that are out there.
And of course, these multi-purpose prevention technologies can also help men, right?
Yeah, there is a growing field now of male contraception, which could empower men to and enable men to also take responsibility around family planning. And some of these, are being looked at to actually provide protection against STIs as well. So that's one possibility. But then also, if the female partner is protecting herself, that protects everybody, the male partner and the family. When you empower women to protect themselves around their their health and their when and if they want to have children, that improves not only the woman's life, but the economic well-being of her family and the whole community. So when women are protecting themselves from HIV and unintended pregnancy, they're protecting their children that are living and the ones that are to come.
Bethany, this has been great. Thank you so much for taking some time to speak to us.
Oh, it's a pleasure. Thank you so much for the honor to be on your show.
Listeners can share this podcast, which is brought to you by the One Health Trust, by email, Twitter, or your favorite social media platform. And let us know what else you'd like to hear about at OWOH. That's OWOH at onehealthtrust.org. Thanks for listening.
Thank you for listening to One World, One Health, brought to you by the One Health Trust. I'm Ramanan Lakshminarayan, founder and president of the One Health Trust. You can subscribe to One World, One Health on Spotify, Apple Podcasts, or wherever you listen to podcasts. Follow us on social media at One Health Trust, one word, for updates on One World, One Health and the latest in research on One Health issues like drug resistance, disease spillovers, and the social determinants of health. Finally, please do consider donating to the One Health Trust to support this podcast and other initiatives and research that help us promote health and well-being worldwide. Until next time.